Aloha mai kako, everyone. Welcome to Not Another White Man's Podcast, where we talk about the intersectionality of race, ethnicity, gender, class, and sexual orientation. Today, we'll be discussing COVID-19's disproportionate impact on minority communities, Kizzmekia Corbett, and Fauci. And then we're going to talk about medical racism and its lasting effects here in America and around the world. As of today's taping, 25.9 million people have contracted COVID-19 and over 430,000 people have died. However, in tracking the disease, we see a disproportionate impact of infection and death for minorities. For every 100,000 people who are Black or African American, 150 people have died. For every 100,000 people who are American Indian or Alaska Native, 142 people have died. For those who are Hispanic and Latino, 123 people have died. For those that are Native Hawaiian and Pacific Islander, 113 people have died. This is in comparison for every 100,000 people who are white, only 100 people have died. Longstanding systematic health and social inequities have put many people from racial and ethnic minority groups at increased risk of getting sick and dying from COVID-19. Social determinants of health have historically prevented them from having fair opportunities for economic, physical, and emotional health. 2, healthcare access and utilization. Healthcare access can be limited for those groups by lack of transportation, childcare, or the ability to take time off from work. Communication and language barriers exist, cultural differences between patients and providers, and historical and current discrimination in the healthcare system. 3, another systematic factor is occupation. People from some racial and ethnic minority groups are disproportionately represented in essential work settings such as healthcare facilities, farms, factories, grocery stores, and public transportation. Number 4, educational, income, and wealth gaps. People with limited job options likely have less flexibility to leave jobs that may put them at a higher risk of exposure to the virus that causes COVID-19. Lastly, housing. Some people from racial ethnic minority groups live in crowded conditions that make it more challenging to follow prevention strategies. In some cultures, it is common for family members of many generations to live in one household. So I'm going to introduce myself today. My name is Seanna Pieper-Jordan. I am your resident sociologist. I am Native Hawaiian, Lakota, and Blackfeet.
Hi, my name is Kendra Dawsey. I am a Black American educator and entertainer based in Massachusetts.
Hi, everybody. My name is Brandee Blocker Anderson, and I, too, am a Black American educator, lawyer, and the CEO and founder of the Anti-Racism Academy.
And just a reminder, you can listen to this podcast on Spotify, Apple, and Amazon Music, as well as YouTube.
Get into it.
Let's start off, Brandee, with your experience with COVID-19.
Okay, sure. So COVID-19 actually impacted my family in a really big way. So everyone in my household contracted it in the very beginning. So late February, early March. So I remember going to work, being really, really ill, and going to work really ill and not knowing what was going on or what it was. And it was still when the news was all just sort of trickling out about what the symptoms were. And so by week 2, I knew that I had it, but it was just impossible to get any tests. But once I lost my sense of taste and smell, it was kind of like the telltale sign. I, was this close to going to the hospital, in terms of the body aches, the fevers. I literally could not get out of bed for a month. And it was so crazy because you would feel better for a couple of days, and the next day you just feel 10 times worse. And my son, he had it. He ended up spiking a fever and having a seizure, having to go to the hospital. My husband had it. I had it the worst. Luckily my son was fine, but everybody on my in-law side of the family had it. I had an uncle who died from it. My grandmother contracted it. So literally it hits so close to home, in the way that the stories I heard about how people were treated, it's just heartbreaking. So my uncle, he had asthma, and he went to the hospital 3 different times to get tested, treated, and they turned him away. And he ended up dying with his inhaler in his hand in his house. And so I'm sure he wasn't counted among the official numbers, but it's a very, very real thing for me. I was close with him. So it's just crazy.
Do you have any other takes about, I love how you went into your uncle saying he wasn't treated fairly in the hospital. Oh my gosh, I'm tearing up. Like, that's just so sad. But do you want to respond a little bit more? Like, did he tell you exactly what like the doctor said?
So at that point, it was just impossible to get any tests. Like there just were not tests available. And so unless you were ready to be put on a ventilator, they just sent you away. They wouldn't even keep him, even though he was having trouble breathing, and they kind of just brushed him off. And so I think, him being poor had a lot to do with it, and being Black. And then, I mean, even when I called the doctor, I got like a telehealth visit, but the doctor was like, he knew he couldn't send me anywhere to get a test. And he's like, oh, you probably don't have it, but stay away from everyone. Like, don't leave them. Like, what? How can you tell someone that they probably don't have a disease that you're not testing for? And so, like, I think that is what a lot of people's experience was. They just were turned away. And lots of times medical professionals, when they don't have the answers, they still give an answer, even if it's not the right one.
Kendra, do you have experience with COVID-19?
Yeah, a little bit. So I have a cousin. Most of my family grew up in New York City, and my cousin got COVID-19 kind of around Thanksgiving time, like in November. And she got it from her boyfriend, who is a public school bus driver. So that is a job which is essential because kids need to go to school. And, I think he was wearing a mask. Obviously, you have to wear a mask and, trying to do all the precautions. But because you are literally around people in a small moving vehicle, you're like, if anyone has the virus, you're going to be likely to get it, right? So she was taking care of him. She said that he went to the hospital a few times and he was sent back. This was around the time where hospitals were expecting that surge that we really saw over the past month. And I think it was starting. They were like, he's not in a bad enough position for us to be able to prioritize him right now, which part of it could easily be racism. He is a Black man, and just the stress of hospitals during this time. So she also got it, and she was doing everything she could to make sure her children didn't get it in her small New York City apartment. Whenever her children left their rooms, they had to wear masks. She would make food for them and then go back into her room where her boyfriend was also recovering from the illness, right? She didn't get as bad of a case as her boyfriend, but it's an exhausting illness. People are in recovery for sometimes months. Sometimes they get complications that, it doesn't seem to really be a sure road to recovery, right? So I was trying to tell her to just rest as much as she could. The fact that her children are wearing masks outside is helpful, outside of their rooms is helpful. And if you are in a small apartment, it's just going to naturally be harder to quarantine. If you don't have the means to quarantine somewhere, it's going to be harder.
I'm in the state legislature and I'm telling my coworkers, I don't drive. I take the bus. I'm high risk. And they said, oh, well, the senator wants you to still keep coming in. And I was like, okay, it's getting worse. It's getting worse. I had a slight breakdown one morning. I need this job, but I'm also scared for my own life, and I'm scared for my grandfather. And so what do I do? So finally afterwards, I had that ability for us to work from home. And I remember there's just the hostility of the boss being like, oh no, I want everyone in because I don't know if you're working all 8 hours. And so you can't go home. But it got so bad with the lockdown where we have to go home. And I just remember everyone making fun of me before it got to the mainstream. And I was like, this is coming. Are you guys ostriches with your head in the ground? This is happening. In Hawaii, we had, the state was tracking the number of those that contracted COVID-19, and then they were tracking deaths. But they weren't disaggregating data. So they weren't saying the races, what race is being impacted by the amount. And then they finally, after activists and nonprofits were saying we need the data, us as a community need the data so we know who we can help. So anyway, then they break it down to but they grouped in Native Hawaiians and Pacific Islanders into one data group, right? So we were thinking, okay, there's this is how they normally do it, which is Pacific Islanders, Native Hawaiians, and all statistics. But what happened was Native Hawaiian organizations are very dominant. They have a lot of resources. But then you have Pacific Islanders. Pacific Islanders are from Samoa, Tonga, a lot of people from that are Micronesian, Marshallese. Micronesian and Marshallese have a compact with the United States because we bomb them with nuclear weapons. And so they are able to go back and forth between us and them. But they also, at the time, in the beginning of COVID-19, did not, they're called COFA migrants. They didn't have access to Medicaid. And so there was a high uninsurance rate. Anyway, so those that are in the Pacific Island community started seeing in these clinics a lot of Pacific Islanders coming in with COVID-19. Those that got very sick, they were saying like, we don't know what's going on, but we think they're being disproportionately impacted. So they went to the Native Hawaiian organizations, some of the big ones, that said, we need your help to advocate so that it disaggregated between Hawaiian and Pacific Islander. So the Hawaiian community came together, Pacific Islander came together, and they pushed the state, who was pushing back because the state didn't want to do anything. And then finally, when they did disaggregate it, they realized that the Pacific Islander community was being impacted, but not just that, it was particularly those that didn't speak English very well. And so when they were hearing, what COVID-19 was, they didn't know, like the translation wasn't getting through. On top of that, they were really suspicious of the contact tracers. They were suspicious of them because they were like, why do you need my personal information? I don't understand. You don't speak my language. You're from a different culture. But afterwards, when activists came in and they pushed and said, contact tracers need to come from the community. Right. They need to be a face that they understand. And so then when they implemented and brought on some people from the Pacific Islander community, contact tracing went up. Like they were able to really track what was going on, and the cases plummeted, and the deaths plummeted.
My professional experience during this time it's like, this is something I knew, but it really highlighted how the failures of like our social net was, how it was just going to make this pandemic worse, right? So in Chelsea, there's a lot of people who are immigrants and undocumented, or know people who are undocumented, right? So there is kind of like an inherent distrust of a lot of government or state organizations and stuff like that, especially in the Trump era where there was, the public charge rule and a lot of things like that. So people were already not really like there were some people who might have been eligible for women, infant, and children checks to like help out their family, but they didn't get it because they were afraid it was going to affect their citizenship. And then the pandemic happened and they were like laid off from their job, or like they weren't able to work because they got COVID. And now they're in like a worse financial position, right? In addition to that, housing is bad. Housing is so expensive. I mean, in the Boston area in general, but when you have like low income people in a very predatory housing market, that's going to create conditions where people can't really quarantine safely. There are some places in Chelsea, or some apartments in Chelsea, where they literally have a different group of people during the day living there and during the night living there, right? So like, it's like people, like the night shift people sleep there during the day and then they're expected to leave. So like, situations like that, it's going to be hard to quarantine. You're in a small apartment with like maybe like 3 people to a bedroom, and there are 3 bedrooms, right? And then, the usual social determinants of health, where people of color are facing not only a racist like medical system, but also just the entire setup of the public world is not working in favor of their health. So like Chelsea has a lot of pollution, which like, it's probably doesn't help if you have a lung disease to be breathing in air that isn't great. A lot of people are reliant on public transportation. So there's like not, it's even harder to quarantine there. It's just a lot to fight against. And obviously where I work has done a lot of things to try to like mitigate all these factors. Like the amount of food pantries and food access efforts like just skyrocketed right after the pandemic because everyone was like, we know this is going to be a problem for like such a long time afterward because of the amount of essential workers in Chelsea, right? And there have been a lot of like efforts to get like people free PPE. And it's a lot to fight against. And like, you know, if the federal government doesn't even actually have a good system to pass out tests and vaccines, like it's going to be a lot to fight against. So definitely my professional experiences have not been heartening. It has eroded any faith I had in the government structure, to be quite honest. And it's really frustrating because it's like, if we had systems where like people could get the help they need without being afraid that they would be negatively affected, we would not be at like 400,000 deaths right now. Our government doesn't prioritize that. It doesn't prioritize caring about people, and
right.
Everyone's affected. And now we have the worst cases in the world. So
the unemployment rate in Hawaii at one point was like 30% for working adults because our economy is completely based upon tourism. And so a lot of these were in service worker jobs as well. And the whole unemployment computer system crashed because the computers and the servers couldn't handle the amount of volume because the last time they updated the servers were in the early 2000s.
Oh God.
Because the state has not invested. Well, the state legislature has invested money, but the state itself has completely, and the departments have completely failed over and over and over to update systems. And so now we had folks that had no money coming in. It took like maybe 3 months on average for people to get their first unemployment check.
Jesus.
And so people were like literally going hungry who qualified for unemployment. So there was that incompetence.
To add to your point about the unemployment system being so like 20 years old and not well functioning, I think that happened to a few other states. I'm not sure how it was in Massachusetts, but yeah, like it's like this entire pandemic has just really shown how much America hates putting money into social systems. And then they're like, yeah, we'll just have the economy crash during this like once in a century pandemic because we didn't update our unemployment system 20 years ago. And we decided to like spend it on, you know, whatever random thing that they like a new football stadium. That's very Massachusetts, but like that's more Massachusetts than Hawaii. But like I feel like that probably happened in Massachusetts at some point. It's disgusting. And in Chelsea as well, we did see, you know, there was a huge like technology gap. That was a big thing. So the school system in Chelsea passed out Chromebooks, which of course isn't like like it's definitely better than nothing. It's not perfect because Chromebooks, you can't like download other systems. It's all Google Chrome, but kids were able to log onto school and like view, you know, go onto the lessons and like type things, which is better than nothing, right? And I think Comcast tried to do, in Massachusetts, they tried to do one thing where it was like, you could get internet for free if you don't have a withstanding balance with us, which I don't know how many people in my specific town where I work in qualified for.
So the Navajo Nation has a reservation that's in Arizona, New Mexico. It's very large. Obviously, we're aware that it's a desert landscape. They are, you know, the ancestry. So on the reservation itself, those that are enrolled, there's 173,000 people. The enrollment number for those who live off the reservation adds to it, but essentially that's what happens. But in the COVID-19 the current pandemic has been 28,000 infections. So that's 16% of the population on the Navajo reservation has contracted the disease. There has been over 1,000 deaths. So that's 3.6% of people who contracted it died. And so at one point, the rate of infection per capita was higher than New York City. So that was kind of like happening at the same time. It was not really talked about in the general mainstream. And when you research it, you start to understand like the things that we broke down, the systematic issues are also unique to American Indians too, especially in rural areas. So they have to drive hundreds of miles just to get into like a store. They have to drive hundreds of miles just to like get to a healthcare facility. And a lot of the healthcare facilities that they have are the Indian Health Service. And we all know that the Indian Health Service, or people who are aware of it, are just like some areas still life or limb. With the expansion of Obamacare and has improved its preventative health. But anyway, so the access to it was horrible. And then also because a lot of people live in these rural areas, they don't have running water. And so they had to truck in to some of the cities. So like Phoenix, they had to truck in to get water. And when they were doing that, the elderly people were going in because they needed that water. So then they were exposed to the general public that had COVID-19. And so it just spread that way. Also, there was a language barrier. So some of the elderly folks just speak Navajo and they don't speak English. And so there was that. And then a lot of folks were low on food. So they had to truck in food as well to each person's door. I think another thing to point out with the Navajo Nation is that it's not the only tribe that ran into issues. So another tribe that ran into issues is actually the Cheyenne River and then the Oglala Sioux tribes up in South Dakota. So what ended up happening was they started seeing infections on the reservations. So they decided to create checkpoints. So anybody who was on the roads going through the reservation had to stop and do contact tracing information so that they knew who was coming and going. So if somebody was sick, they asked them to turn around and go back the way that they were going. And then the tribes were saying like, we cannot afford, because we're in this rural area. One is in Pine Ridge Reservation, which is maybe bottom 4 poorest places in the country. They were saying we don't have access to healthcare. We don't have access to cars. We don't have access to running water. If we get hit by COVID-19, we're going to get wiped out. But what ended up happening, going back to your point, Brandee, about some folks in the South not believing in the disease, the governor of South Dakota started complaining and went to the Trump administration saying, like, they're not allowed to do this because we don't really believe in COVID-19. And so the tribes can't block the roads, which is interesting because technically it's a gray zone because they might be able to block roads, but it's like a lawsuit waiting to happen about tribal rights. But so those are examples of what systematically is going on for tribes.
Yeah. Slightly related to that note, I have a friend in Oregon who started kind of like a mutual aid fund at the start of the pandemic. And he was like, yeah, I got PPE to a native tribe. I'm not sure of the name of the tribe. It was like a tribe in Oregon before the government did, because the government was so inept. And like he just purchased a lot of PPE and like sent it over to them and was able to reach out to them because of like connections that he had instead of the US government, which is supposed to be taking care of stuff like that. So,
yeah, I think it's very telling that both the indigenous people of this country and Black Americans are in this situation, considering the history that our groups have with like infectious diseases and structural racism. And so Kizzmekia Corbett is an American viral immunologist at the Vaccine Research Center, or VRC, at the National Institute of Allergy and Infectious Diseases, National Institute of Health, aka NIH. So she was appointed to the VRC in 2014 and is currently the scientific lead for the VRC's coronavirus team, with research efforts aimed at propelling the novel coronavirus vaccines. So in December 2020, the Institute's director, Dr. Anthony Fauci, said, Kizzy is an African-American scientist who is right at the forefront of the development of the vaccine. So at a press conference, Dr. Fauci sort of pushed Kizzy out there as a way of showing Black Americans and Americans who may be having vaccine hesitancy that, in fact, the person who is in charge of developing the vaccine is a Black woman. So according to an article by Nefertari Brewster of the Atlanta Black Star, the Department of Health and Human Services is investigating a series of controversial tweets posted by Ms. Corbett, who recently drawn national public attention because of her social media presence. In particular, her Twitter page dating back to February of 2020 Going to a tweet from March 29th, she tweeted a link to a Bloomberg article about the impact of the virus on poor communities. In her accompanying comments, she suggested that the doctors may choose to overlook Blacks if ventilators are in short supply. She said, I tweet for the people who will die when doctors have to choose who gets the last ventilator and ultimately who lives. The tweet says the poor, and while the article doesn't explicitly say so, it's the Black. She further suggested in a follow-up post in April that she subscribes to the notion that the pandemic is an act of genocide against Blacks. In her tweet, she said, some have gone as far as to call it genocide. I plead the fifth. This was from April 11, 2020. Mm-hmm. During a news conference on April 10th, the Surgeon General, Jerome Adams, said that data shows that African Americans and Latinos have been dying at higher rates than other ethnic groups, and that's attributed to the fact that these minority groups suffer from underlying causes such as diabetes, obesity, and other health issues. He also called for the underserved to abide by stay-at-home orders, and so his exact words were, we need you to do this, if not for yourself, then for your abuela, do it for your granddaddy, do it for Big Mama, do it for Pop Pop. The nation's top doctor said at a task force briefing after pleading for minorities to stop their use of alcohol and tobacco and become more diligent about hand washing and social distancing. We need you to understand, especially in communities of color, we need you to step up and stop the spread so we can protect those who are most vulnerable. Dr. Fauci, a top infectious disease doctor and key member of the White House Pandemic Task Force, backed Adams' statement. He said, Jerome, you did beautifully. You can't do it any better than that. And he said, I know Jerome personally. I can testify that he made not even a hint of being offensive at all in that comment. So in response to that, Dr. Corbett, Kizzmekia, she retweeted a post that was critical of Jerome Adams's comments. So the post she retweeted was, pasting this thread here because it's appropriately put, Black people are not dying more because of their behaviors. That is just a cop-out to adjust accountability. And so the post that she retweeted says, Dear Dr. Fauci, Dr. Adams' comments weren't offensive because he said Big Mama or Granddaddy, though folks are free to be offended by that language. They're offensive because they ignore systemic racism. Cigarettes and alcohol aren't killing Black and Latinx people. So I put all that out there to sort of pose the question, well, one, like, what does it mean that this person who is obviously very high up in the government as far as the vaccine research and all that is concerned, that she too she's been accused of advancing conspiracy theories that the virus is itself a form of a tool of genocide. So what do we think about that? And then the fact that she's now she came under investigation. She has since privated her Twitter. And so I don't know, y'all. I don't have anything a fancy segue from that, but I thought it was just very interesting that one, her race is being used to get people to feel more comfortable taking the vaccine. But at the same time, she's saying that she pleads the fifth, which for those of you who don't know, the Fifth Amendment is your constitutional right against self-incrimination.
Yeah.
So the fact that she's a part of the government pleading the fifth on whether or not there's some kind of scheme, intentional genocide happening is.
I don't. Do you think she actually meant? I think it's, for me, if you look at the comment, the tweet about genocide, and it's metaphoric. Maybe not exactly, but it could be metaphoric in the sense of we're just abandoning minority communities, the healthcare system, and our government. We're just letting them contract and just, say you have to deal with it yourself. We don't have healthcare for you. You're uninsured. So we're going to just ignore you. And so in that way, because you're disproportionately impacting minority communities and leaving them to die.
So do you think she was just keeping it real?
That's my sense. Yeah. And I mean, even Dr. Fauci himself, who is not above criticism at all, but he talked about how difficult it was in the Trump administration to just get them to acknowledge the seriousness of this, the virus. So I'm guessing, even though she's not elected, right? So I'm guessing even as part of the government, or being in a government position, she probably was pushing up against these kind of attitudes. I think the Trump administration kind of early on the pandemic, I think it slipped up that they were kind of yeah, we're not going to give as much materials to blue states because they don't like me.
Yeah.
That's that. And then the manifestation of that, like, yeah, it's going to be like lots of people, especially people of color dying, you know, like that. Yeah, I think like you could definitely say like, yeah, that is a form of like metaphorical genocide. So I'm guessing she's saying that not to be like, yeah, I helped out with this, but just like, wow, I saw some mess in the Trump administration and like, yeah.
I can identify with her because when I worked in the state legislature and I just saw the bull that was happening behind the scenes with the elected like officials, I got so frustrated every single day you come in and you're just like, you guys are incompetent. You are, you know, corrupt. And you just see that and it just gets to you. You know, she's trying to do her job, first of all, and she's under the Trump administration. I do want to point out one thing about this. I remember hearing Fauci. Fauci's such a like complicated person, especially with his history with disease. But I felt like it was he put out folks as, what is that? Token. She was like a token. Right. And I don't know how I feel about that really. He did do things like he went on Lil Wayne's podcast just trying to explain like why infections were worse for people of color. And I don't know how I feel about that. I do appreciate the sentiment. So he also went on the BET like podcasts. So I appreciate him reaching out and like attempting to educate the community, but also it just makes me question why he was supporting the comment by the Surgeon General. That's just straight up racist, what he said.
Like obviously Black people and other minority groups know how to social distance. Or like, I don't think people not social distancing is a higher proportion of people of color than like non-white people. I think white people are probably doing the most like, let's still go to the bar. But yeah, that was an offensive comment. I've heard reading some stuff about him and in the Reagan administration and his response with HIV/AIDS, which I think Seanna, like you were going to speak on it later. It seems like he like does listen to people and he's able to change his mind based on new information, which is like a basic thing you should be able to do as a scientist. Hopefully he realizes why the Attorney General's statement was ridiculous, you know? Hopefully he understands that it's not like, like Black people or Latinx people are just dying because they drink a lot. Like that's not what's happening.
There's more to it.
I hope he knows that. I hope he knows that now. I hope when he was on Lil Wayne's podcast, he was like, yeah, just stop smoking blunts, Scott. Like, I hope he said something useful. But who knows? I don't listen to Lil Wayne's podcast. No offense, Lil Wayne. I just didn't even know he had a podcast.
I just thought it was interesting. Like, he's been trying to reach out to communities that are disproportionately impacted. But I think that we are going to talk about it, but like the HIV/AIDS epidemic, he was attempting to use language that was progressive. However, he wasn't getting it right all the time.
Yeah. He was like a 50, 40-year-old straight guy in the 80s where like 30s. They called homosexuality a disease. Yeah. Like he probably wasn't going to be on the mark, but
no. So Brandee, what's going to happen to her if she gets, what's like results?
I think that by this point, the sort of heat has died down. Like when I searched the story, like there hasn't been anything recently posted about it. I think it goes back to what Kendra said, like she's kind of a token and they need her. So even though she's like, you know, ruffled some feathers, I don't see them firing her over some tweets. Now there were some other tweets that she posted from like 2010 through 2012 that were even more colorful about her love of white men and how she hopes that her children go to school with white people. And
God,
mother like cringy, like I wish I didn't know this about you.
The people need to know that there are services you could sign up for that will delete your tweets before a certain date. Like we all develop and change. Do you need that tweet from 2010 that's like, man, I love pink dick? Like, no, you don't. Just get rid of it. Just get rid of it so no one will be like, excuse me, here are some receipts. And you're like, wow, I really said that as a college freshman or whatever, you know?
The tweets are problematic.
Yes. Yeah,
really?
that is problematic.
Like, pictures you knew that you had NIH dreams. Like, the last thing I wanted to say on it was this person, they had some interesting retweets that I thought gave some good information. So this person was responding to her tweets. He said, Dr. Kizzmekia Corbett's remarks that have raised such a stir are hardly off the mark, given the long history of medical experimentation on Black folk under dint of coercion and or without informed consent, plus frequent medical maltreatment. In the past, so-called resurrection men surreptitiously would dig up recently buried Black bodies to be used as instructional cadavers by white medical students. Even in death, the Black body was subjected to exploitation. And in the present crisis, it's been an open secret about whom are the preferred subjects for the pharmaceutical and vaccine trials for COVID-19. Black folk here and overseas. Dr. Corbett has marked another evolving atrocity.
We could talk a lot about the reasons why there are a lot of people of color who are distrusting of the vaccine.
Yes.
And the main reason why is because there's a big history of experiments on people of color, medical experiments on people of color. I think one that is probably most known in reference is the Tuskegee syphilis study, where basically the U.S. Public Health Service just let Black men who had syphilis, they didn't treat them even though there was a known treatment for syphilis, and they just let them keep having syphilis to see what would happen. So that is something that a lot of Black people think of when they think of that. And I think the people in this study were given like shots that weren't actually shots that would help treat them. So I think there is a very visceral connection of that. But even beyond that, there has been a very, very long history in this country of people of color being used as medical experiments. The one I thought of, which is maybe a little separate, but still it keeping in this trend, this really unfortunate trend in history, is contraceptive trials in Puerto Rico. So the first large-scale human trial of the birth control pill was carried out by Gregory Pincus and John Rock in 1956. These two men ran trials explicitly on poor undereducated women in Puerto Rico before birth control pills were approved as safe in the mainland U.S. Puerto Rico was chosen as the area for the trial in part due to Puerto Rico having more lax laws on contraception. Contraception in the U.S. was actually banned for a very long period of time. But also, they felt that Puerto Rican women in poverty would benefit from not needing to, or like not having the ability to give birth to more kids, right? So they were really preying on poor women. The way they got participants to sign up for this trial was simply by telling women like, oh, if you take this pill at this point every day, you won't have any more kids and you'll be able to just like focus on raising the kids you have, right? But they didn't mention that there were a lot of there was a lot of unknowns in this experiment, right? So they were still looking for what were the negative side effects. They wanted to see what the negative side effects would be. The dose that they gave these women in these trials, I think was like 10 times higher than the modern dose. So up to 17% of women in these trials had negative effects like dizziness, nausea, blood clots. 3 participants in this study died, and their bodies were never autopsied. So the people who were running the study were able to say, "Oh, they just died. There's no, we don't know why, if it's actually correlated to us testing the birth control pill, right?" So the way they also explicitly said to these women, like, "Oh, you won't have children again, and you won't need to be sterilized," because that was really, I think, in Puerto Rico at the time, that was like one of the main forms of birth control in addition to abortion. But they weren't warned of any of the unknowns, unfortunately. So it was a lot of just experimentation on women who were told something that, they were told the like positive parts, but not the negative parts of this issue, right? And that is just one example that is aside from the history of gynecology, where the man who is constantly referred to as the father of gynecology really just operated on enslaved Black women without anesthesia. So yeah, there's a really big history of people of color not trusting doctors. And I think, now we see it in terms of their responses to people who have COVID, right? Like, so this is going to be something that the American establishment really needs to overcome to make sure that people trust the vaccine. People trust what's going on. And also, that is a little bit separate from the fact that vaccine rollout has been atrocious anyway. So if there is a Black person who wants a vaccine, it's probably going to be hard for them to get it. And if you want more people to take the vaccine, you should do less medical racism. You should do less medical racism in general, basically. Very, very basic thing. So
I have something to add to not medical racism, but disease racism. Like, when the Europeans came over to the United States or when they came over to the Americas, the Europeans came over to the Americas, they brought with them many diseases like smallpox and syphilis. And that wiped out millions of people. So talk about a genocide. It wiped out millions of people in the Americas. And then it also wiped out, basically in Hawaii, the population went from 300,000 to 30,000, I think 40,000 by within like 120 years. And a lot of that, when they say it's like smallpox, syphilis. So, Europeans are a little dirty. Like, they should have used condoms when they first came over. I don't even know. Like, we all know how that spreads. But anyway, I do want to point out, so there was that, and then they just spread their diseases, but it was also intentional. So when they started putting Native Americans on reservations, they were giving blankets that had been exposed to smallpox, people with smallpox, to the tribes and to the members of the tribes. So those on the Native Americans on the reservation were taking these smallpox blankets and dying from smallpox. So it's actually weaponized. They weaponize diseases, and we're just straight up dirty.
I'm pretty sure William Amherst who Amherst College is named after, like, he's famous for giving smallpox blankets to Native people.
Oh, that's who did that.
Yeah. It's really deep rooted. Like, a lot of
right here.
Smallpox blankets. Yeah.
Smallpox blankets.
Yeah. It's and the gynecologist I was talking about, his name was J. Marion Sims. So yeah, he was known as the father of modern gynecology, but he almost all of his experiments were without anesthesia on enslaved Black women.
Oh my God.
It's like, yeah, we probably could have found out about gynecology with, like, in a more consensual, like, where you actually, like, gave the person anesthesia and gave them informed consent, which is very necessary thing for any, medical trial, right?
People aren't crazy for being like, give me a longitudinal study over a couple of years, like, I just want to see. But at the same time, according to like Dr. Corbett, they've been working on this technology for many years, since the last SARS outbreak. And so, this isn't the traditional vaccine that's a dead version of the virus. This is using a different kind of technology. And so they were kind of able to, like, get it ready and then just, like, slip in the right pieces, is my understanding of how they were able to develop it. But I also, like, I don't know, I want to see what it do to y'all first a little bit.
And that was like my outlook too. Yeah. I think, like, now that's especially possible for most people because the vaccine rollout is not working as well. And it took like Black people I know who are in the medical field, or like I have one friend who's a midwife, and she's like, yeah, I got the vaccine. I did the research. I got both my shots and I feel fine. And I was like, okay, well, if you like that was the person I trusted who did, and then like a few other people, right? Vaccines in general are good. And
yes,
there's a lot of reasons to not trust either like Pfizer or Moderna, or like be skeptical of a lot of things, or be skeptical of Trump. Like I remembered that Trump like put in a lot of money to like help develop vaccines. And I was like, oh yeah. And then my friend was like, actually, these vaccines were mostly developed in like Germany. And I was like, okay, that makes me feel a little bit better, right? There has been something I've read as like the vaccine was being developed, was that they do want to get more people of color in vaccine trials to make sure that the vaccine isn't hurting anyone disproportionately, right? Like, it's whenever you're doing any sort of study, it's good to have the very diverse amount of people, so you could actually see how the vaccine affects everyone, like not just like white middle class people, but they had such difficulty getting black people to sign up because of this history. So like it's kind of I guess like not I wouldn't necessarily like say self-reinforcing, but maybe it is. Like it's like I mean it is. Yeah, it's like yeah, if you like target people to without informed consent and do experiments on them, they're not going to want to participate in your good experiments or like, so yeah, there's going to need to be a really concerted effort from the medical establishment that probably should have started way before the pandemic, way before there was a crisis point, to actually heal the wounds people of color have with these institutions. So the Planned Parenthood founder lady, she like set up like a birth control like clinic, and she was arrested. And like she was also racist. Like I'm not saying that to be like, oh, poor her, because she was like racist and a eugenicist. And like the laws were so crazy that she was like, oh yeah, here's how you stop having 8 babies in 10 years. And they were like, no. And this was like 1920.
Yeah, no, there's a lot of that. So my grandmother was actually sterilized against her will and without her consent. Like thankfully it happened after my mom was born. So shout out to that. But like it's a pretty terrible thing. No, she suffered from mental illness and was institutionalized. And so people in that position, obviously, maybe not obviously, but especially being a poor Black woman, like in the 1960s when this was a prevalent thing. My understanding, it was the kind of thing where you would literally go in for something like appendicitis and they would just like do it while you were out, like that level of life. And even like I know my sister shared with me that like she went in for like a postpartum appointment, and like the doctor or the nurse, whoever, just came in the room with papers for her to sign over to get a hysterectomy. And my sister at that point was like 21.
Oh my God.
And she hadn't asked for it. It wasn't like, now mind you, she had 3 kids under 3, but still like none of your damn business, right?
Yeah.
Like, hold on. And the woman just like came to her with these papers, like, all right, well, and the same thing, and something similar happened to my mom. Like, like a doctor or nurse or, whoever tried to like tell her, like, oh, you shouldn't, be having more kids because then you have to buy, 3 pairs of shoes. Was what the woman said. And even as I was in labor with my son, a doctor or nurse, whoever came in the room and was like, I'm literally in labor trying to like, just get to 7 centimeters dilated. And the woman wants to talk birth control with me. And I'm just like, bitch, are you crazy?
Yeah, it's really awful. And the doctors that like did the trials in Puerto Rico, exactly what they said to your mother is what they said to they're like, yeah, it's really hard, raising lots of kids. You could take this pill and you won't have any more kids. And of course, if you are a poor woman in a colonized place, you will probably be like, yeah, it is going to be hard to have kids. But like they didn't mention the negative effects. So like there was a lot of women like, suffering physical effects that just didn't. Yeah, it's messed up. Yeah, it's messed up how like they're like, oh, like, you need to like the focus on birth control is always on people of color and not like everyone, right? Like it's obviously it should be open as a choice, but it shouldn't be like, so you had your first kid, don't you want to make sure you don't have another one? Like it, it's stuff like this. Like I don't think I want kids for a while, but it's stuff like this where it's like people are trying to sterilize Black people. To get back at them, I should just have 5 babies just to like.
I do want to point out something that's unique to like Native Americans. So in a lot of these reservation areas, like the only access they have are to facilities called the Indian Healthcare Service. Mm-hmm. And for many, many years, the Indian Healthcare Service is funded by the federal government. They underfunded it. And so the only thing that they could offer people were life or limb. So if you need your limb removed or you're dying, that's the only services. So there was no preventative health opportunities for folks. They had to drive like 300 miles in some areas just to get to a preventative healthcare service. And in Montana, like that was happening all the time. So the Indian Healthcare Service, so when they passed Obamacare, they were able to get an expanded Medicaid, and then the state of Montana and like other areas, you have to expand Medicaid opportunities within the state. So when Medicaid was expanded, in some areas, it was able to pay for preventative care in the IHS areas. And so it expanded the ability to treat some of these underlying issues. So it was just a lack of access to healthcare that kind of exasperated this. You're able to educate people about the intake of sugar because before there was no sugar. Also, it comes from the fact that like the US government used to just truck in some of the worst kind of food because they killed off all of the like natural environments and didn't allow them to go forage and hunt. So then they decided to bring in like flour and really high calorie / super horrible food. Like they still give like chunks of cheese, you know, the velvet. Anyway, so they send them boxes, and then the U.S. government's like, "Oh, we're going to give you high calorie foods that are not healthy, and then now you're going to have diabetes." Like systematic racism, yo.
Yeah.
Well, Sean, let me ask you this: if you had opportunity, and I don't want to like hijack the conversation, but I just want to get your answer on this. If you had the opportunity to take the vaccine right now, would you take it?
Yes. I'll take it because of the fact that I read the science behind it. The fact that like the vector itself had been in development much earlier for a longer time. And so they and then the fact that it was happening with all the smartest people around the world. It was a world international effort. They sequenced the genome, and you have every top person in the field on this. So once I read that, that was fine. But I also was waiting for the Biden administration to come in. I was scared about the Trump administration just because, like, how can you trust somebody who was using it as a political ploy, was not abiding by guidance from the CDC? How can I trust that they oversaw this correctly? The FDA, there are political appointments in a lot of these departments that oversaw the vaccine going forward. Like they were all lapdogs to Trump. And so I was afraid. I was really afraid that the proper procedures were not followed. So I read on the science, and then I also started reading what was passed in the European Union and in the UK. So I was seeing which drugs that they were okaying, and not more EU, because the UK has like Boris Johnson, who's like
who's
their
Trump
version
with
of
a fancy
Trump.
accent.
Yeah. So it was like low key. I don't know about UK. Plus they Brexit. So I was like, I don't know what's going on there.
No,
but so yes, I would take the vaccine today. Yeah, I mean, I'm waiting. I'll probably be the last group to get it. I have no pre-existing health conditions. I'm 31, just like straight chilling. Let everybody else get it. I have no contact. Anyway,
that's my thing. It's like I feel like I'm so far down on the list. Like I don't leave my house, so like by the time it's my turn, it'll have been at least a year probably. Yeah. So if anyone's gonna turn into a zombie, it'll have happened.
Yeah. But yeah, I was also like kind of in the wait and see until because of my employer, I was able to like get it. And it, you know, I don't want anyone to think that I pulled like a OJ Simpson or like whatever, that rich guy that literally flew to like Montana and took vaccines from Native people. Like I didn't do that. That's happened. People are like stealing vaccines that are supposed to be allocated.
Like, foreigners are coming. Like people from like Canada are coming to like get vaccinated in Florida and stuff.
Yeah, no, it's not good. So like, yeah, my employer had a certain amount of vaccines. You probably figure out who my employer is, but like, yeah, they have a certain amount of vaccines. It was supposed to go to a lot of people, like frontline health workers, but apparently not all of them wanted it. So then they opened it up to like everyone who was in the network. So I was like, you know what, I am occasionally, like I as part of my job, I do like occasionally do work at a food pantry. So I'm like, technically do come into people. The food pantry is in a medical center. So like I could technically come into like contact with patients.
Yeah.
Let me do this. So
if they mandated it, do you think how do you think people would react? Like,
people in like in America, there'd be so many.
Oh my God.
Like they're trying to give my kid autism, and it's like, that's not what they're doing.
So Bill and Melinda Gates, I think we were talking about this earlier at some point, I forgot to say, but Bill and Melinda Gates said we have to target vaccines to the most vulnerable population bases, not just age. Like they said age, but they said that Black Americans and American Indians should be vaccinated first.
I think that was why the original backlash happened, because any other time Black people are never first, right? Like in the line in terms of like, you know, disease development for things that we typically think about, like we're kind of last, like to go to the point we were just talking about before about the lack of Black people in these trials leading to us having like poor outcomes with them. So like to all of a sudden be like, all right, hey, we have this new vaccine we're developing, and guess who we want to go first?
Can you go first?
Like,
oh shit!
Who are you talking to? And I think that was people's problem. The fact that like people like Bill and Melinda, and even for me, the messaging in the media, I felt like the emphasis on talking about the issue of the disproportionate effects. Like on the one hand, like yes, it was in the moment of George Floyd and all of that. So I think that there was this, I don't want to say feigned or like faux sense of like concern, but like it seems like more of a talking point that some people heard as great.
Well,
now we don't have to care.
Well, I do have to
heard it as like, oh wow, we're like actually highlighting this issue that we never really talk about. Some people heard like, oh, it's only Black people in them. Cool.
I do want to give background on Bill and Melinda Gates. They've actually been a leading figure in vaccinating for the flu around the world, and then also flu vaccine development to have it more targeted so it can hit more strains. So they've been doing this for years. So it's not like they're just now joining.
And he actually put out a TED Talk like, it's very creepy, but like 5 years ago or something like that, where he predicted that this very thing would happen. I don't think anyone is questioning, Bill and Melinda Gates as far as like having lots of money and influence in this space, or even like being well intended. But like anytime you say people of color should go first, knowing, or you should know there's a history that people will like not have a positive reaction to. Like, no, we don't want to be your guinea pigs, period.
This was an awesome episode, folks. I'm so glad that Brandee and Kendra were able to join us. Hello, I look forward to you coming back next week. So before we wrap up, I think that if we want to do any last minute shout outs to something or to wrap out with last thoughts.
I will give a shout out to the Black Doctors COVID-19 Consortium here in Philly that's headed up by one of my sorority sisters, Dr. Ayla Sanford, who has gotten all kinds of national recognition for her work around not only testing in Black communities here in Philadelphia, but also leading the charge with the vaccination. I see you, Soror. I don't know if I'm next in line, but I see you. We see you.
I want to give the opposite of a shout out, like a FU to that like 22-year-old white man who was like, yeah, I could handle the vaccine rollout for Philadelphia, and he fucked it up. So fuck that guy.
I got a couple shout outs. One, AOC for calling Ted Cruz out. Girl. 2, Native Reacts. It is a channel on YouTube with 2 of the funniest Native guys. They're from the Navajo reservation, where they do random memes, and you get to hear a little bit more about Natives' dark humor. Also, follow up from our last podcast episode. I am still single. Anyway, hit us up. But my last thought and suggestion, what I learned was be safe, stay home as much as possible, be conscious and courteous to your neighbors during this time, and then also wear a condom. Thank you so much for listening to our podcast today. If we encourage you to continue this conversation with us by writing below in our YouTube channel your comments and discussion. Trolls, be nice.
Be nice. Be nice. That's good.
Bye, everyone.
Bye, everyone. Thank you so much for listening. And stay safe out there.
Yes.
The government doesn't care about you.
No, they do. Like, kind of. Like,
no, they don't. No.
Trump didn't. But we have Biden.
Listen, what Kizzy say? Kizzy said she plead the fifth.